Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on mentors and motivators who are consistently reshaping, redefining, and rediscovering the field of medical health care. I would like to welcome Dr. Kenneth Orbeck. Dr. Orbeck has dedicated his BodyLogicMD practice in South Carolina to practicing integrative and functional medicine, and is a successful and effective proponent of pellet therapy, a form of bioidentical hormone replacement therapy. Thank you so much for joining us today, Dr. Orbeck.
Oh, you're welcome.
So you got right off the podium from delivering a 8 hours worth of workshop lecture yesterday.
Yeah, it was fairly intense. Got a little hoarse last night, but it was all good.
Well, we appreciate you spending some time with us.
You're welcome.
So let's go back to your youth and what initially inspired you to go into medicine. Did you always have an interest in the sciences?
I was always interested in physiology and anatomy. I remember as a youth, I set up probably when I was maybe 12 years old behind the furnace in our basement. I hit a sheet, I put a sheet up on the wall and I set up my own little operating room back behind the furnace. So I would go out and I would catch these little frogs, right? And I would go get some ether from you could get ether from the pharmacy back then. And I would sedate the frog and I would actually operate on these frogs. Isn't that ridiculous?
Amazing.
So I love physiology, love mechanics, used to tear everything apart, very intuitive. Tore my mom and dad's furnace apart when I was young and they had to get somebody to repair it because it was in the cold of winter and we had no heat. So I was very, very intuitive as far as going into mechanics and physiology and anatomy and that kind of thing. It interests me. It always did.
So what did you study in college?
I went to college, actually. I started as an engineer. I wanted to be actually an electrical engineer. And I went 2 years as engineering. And I took a course in biology. I love biology. And once I took a course in biology, it kind of led into physiology. I did a little bit of that. And then I got to do a little bit of an anatomy course. So I went up into my professor 2 years into college, and I said, I want to switch to pre-med. He goes, oh no, that's not possible. Not 2 years into college. And I was getting fairly decent grades. I wasn't a straight-A student. You know, I had other interests too. I liked to golf, I liked to ski. But I was doing good, I was holding my own. And he tried to talk me out of it. So what I did is on that summer, I took an electron microscopy where we looked down deep into, electron microscope into cells, and it just really fascinated me. And so I self-enrolled in a lot of the pre-med courses. And the professor came up to me in the beginning of the year, in the fall after the summer. He said, I see you enrolled in all these courses. I said, well, I'm going to go to med school with or without your help. He says, it's pretty cutthroat. I said, it's okay. I'll do what I have to do, and if I don't get in, I'll try again. So I switched over, and I went into pre-med for the final 2 years. I had to do summers to catch up on my work. And
Puts a dent into your golf game, I'm sure.
Yeah, it interfered with my golfing. My handicap went way up. But, at the end of the day, it was a good transition because I had a lot of background. I used to really like to build things, and I liked, mechanical engineering, electrical engineering. And then when I went into medicine, it really opened up a whole new avenue for me, looking into the cell and looking at physiology and how things work and on a live plane. It was really kind of cool. So I got through college and then I applied to medical school, and it's a real good end of the story.
It was really just the beginning of the story.
Exactly.
Actually. So what led you to osteopathic school to go that
I applied
route?
to both colleges, actually, and I preferred osteopathic medicine. I lived in a small town when I grew up. My doctor was an osteopathic physician. And I remember my mom taking me into this old home. It was like an old house. And it had little rooms, which were all little examination rooms. And he did everything. I got my finger caught in a hedge clipper and cut half of my finger off. And she would put me in a car, she wrapped it up, and she would take me to the doctor. He put me in a room, and he would calm me down, anesthetize me, and he fixed my finger. And anything that went wrong, he would help us and fix it. So he was like a broad-range family practice doctor. I thought that was pretty cool. And the osteopathic profession looks more holistically at the entire being, incorporates different levels as well as energy, body, mind, spirit, the whole thing. And that's kind of my forte and kind of where I wanted to direct my future. And so I actually chose in Des Moines, Iowa, to go to the University of Osteopathic Medicine and Health Sciences.
So after graduation, you went out to practice. Were you practicing obviously traditional osteopathic medicine, or when did you come to go into integrative and functional? What inspired you to do that?
After I graduated from the University of Osteopathic Medicine and Health Sciences, and I did my rotating internship, I decided to go into regular family practice medicine. And so I stayed local in the community that I actually did my training in, which was not Iowa, it was Michigan. It was on the east side of the state in the Grosse Pointe Woods area. And I practiced medicine in that area, and then I eventually moved up to Flint, Michigan, where I opened up a really nice family practice center. And Flint, Michigan at that point was actually pretty affluent. Grand Blanc, Michigan was my home.
You didn't drink the water when you were there.
I didn't drink the water. Of course, the water back then wasn't like it is today.
I'm sure, nowhere.
But I still have a problem paying $7 for a bottle of water.
I'm sure.
So I opened up a family practice center and affiliated with a hospital. And then I did basically broad range family practice. Originally, I even started doing a little bit of OB-GYN. But I did some minor surgery. And I did like general overall medicine, diabetes, heart care, general wellness. And I was always interested in nutrition and wellness. It was always fascinating to me to understand the cell and the mitochondria and energy involved in the Krebs cycle and how nutrients play a role in your overall body performance. That always interests me, especially in athlete, in athletics. So, I affiliated with actually an athletic center, and we had a rehabilitation center right next to my office where I used to do like treadmill stress testing. And I was involved in some of the performance aspects of medicine as well in the athletic field. So that ended up to be a really nice practice. In time, however, I really didn't want to stay in that community long term. So I wanted to transition into, a little bit nicer environment. So I transitioned actually just temporarily into northern Michigan. And that's where my life changed, because when I went there, I actually was cutting down some trees in my backyard. And doing that, one tree got away from me a little bit, and the wind kicked up a little bit, and the tree was falling down over our home, and my two children were in the kitchen. So I wrapped the rope around me, and I pulled the tree as hard as I can to pull it off of hitting the kitchen. And it hit the garage, it bullwhipped me, threw me in the air, and it landed on top of my torso. So I had a complete crush injury. It broke all my ribs, it contused it broke my spleen, contused my kidney. I also had what's called a tension hemopneumothorax, and so I had blood under my lung pushing my heart to the right side of my chest. And it was a very difficult experience, and when the paramedics got there, we all knew that this was probably going to be my last day. So they did a chest tube on the field before they put me in the ambulance, and as soon as they took the tree off of me, I lost consciousness. That was a very peaceful time, and the funny part about the whole thing, when I think about it now, is, I woke up seeing all these beautiful bright lights. I thought, wow, I'm in heaven, that's good, right? But I hurt all over, and you're not supposed to hurt in heaven. I realized I was in the intensive care unit. So it was through that whole process and pain where it took me out of medicine for a year, and I understood total loss. And once I understood total loss and wanted to refocus my career, I didn't even know which direction to go in. It was a real self-examining time of my life. God got a hold of my attention. And I actually thought about it, even enrolled in seminary to possibly change my career. But the inner voice within me spoke and basically said, you can really touch people one-on-one who are sick and hurting. When they reach out to you, and they're reaching out because I understood pain, I understood abnormal health. I understood that. So if I'm able to reach out with that pain and help others, then that is my career I want to get into.
Choking me up.
But, you know, you grow in life through pain, and it's a stairway to evolve, and understanding the stresses in your life really mold who you are, and they develop your character. They make you self-examine what you want to do with your life. And that's what I did. And so, you know, after that year of recovery, which was difficult for me, I had to, again, reboard to start medicine again. And I called a recruiter, and I told him, I said, you know, I said, I can't go overseas. I want to do missionary medicine, but I can't go overseas because I don't have a spleen and there's higher risk for me with infections. So I said, where can I go in the United States where I can really reach out and help those in need? And he said, I have the perfect place for you in South Carolina. And they sent me down into a rural, tiny little town in the PD of South Carolina, which is like a swamp area. It's just outside. It's actually inside of Myrtle Beach, but it's actually in the inner circle there of the, you know, lower socioeconomic class. And they had a small hospital. And the CEO of that hospital, he and I talked, and we met, and we really connected. His name was David. And he said, I want you. And so he recruited me, and he recruited 3 others, a surgeon and 2 internal medicine, to build this hospital up. And so we were recruited down there, and we started a mission really to help grow this hospital. And what happened is that the hospital eventually lost their funding because it was owned by another hospital, and they were not willing to continue to pour money in that direction. And that's when I actually moved up into the northern part of the state of South Carolina. And then I opened up a family practice center there. So I enjoyed that, going up into the northern part of the state, and then we opened up a family practice center. I saw a real need there. I saw a real need where the outlines of the community didn't have access, no community access. And so my practice eventually turned into a mobile medical care practice. I went and bought an F-350 Ford vehicle, turned it into what looked like an ambulance, and put all my equipment on the truck. And I started to deliver health care to patients' homes. My wife was with me at that time. I through my injury and all the loss, you know, that pretty much destroyed what I had as far as my marriage and that kind of thing. So coming to South Carolina, I rested, recovered, and I met a wonderful woman from overseas, from the Czech Republic. Brought her to the United States through a J-1 visa. And she's a real sweetheart, supports me, loves what I do, and joined me in doing mobile medical care. So she would ride in the right seat of the truck, and she would take phone calls and make appointments, and I would drive with a GPS, and we would go take care of people in their homes. So it was a pretty exciting time, and we did that for 2-3 years, finding there was so much need there that we really needed additional help. Durable medical equipment, care within the home. So that whole organization eventually turned into a hospice organization that we developed, owned, and operated. And so we did hospice care, helping those who are at the end stages of their life. I understood a little bit about death and dying because I had a near-death experience, and I wanted to help reach out to others. Did that for about 2 or 3 years. Got to be pretty difficult, though, because I had so much in my heart for wellness and nutrition that I was on the other end of the spectrum. It was a good place to be temporarily, but it wasn't my home. So eventually what I did was I left the hospice, transitioned it into another company, and that's the point where I searched what I could do to get into wellness care. So I went to Myrtle Beach, and we leased a small facility, and we opened up a wellness center but I really didn't have any education or know how to do this, right? How am I going to start utilizing like bioidentical hormones, and how am I going to do like detoxification, and how am I going to research and understand nutrition within your body? How am I going to do that? And so I'm Googling and I'm looking, and I come across the A4M. So I Google the A4M and I look, and they have a module, Module 1, Hormone Optimization in Las Vegas. I said, Ava, this is it. We're going to Vegas. So we packed up and went to Vegas. I'll never forget my first module. I walked in and I said, oh my goodness, are you kidding me? This is huge. This is unsurmountable. I'm never going to be able to look at what this is about. Look at what I have to do. And I just looked around and I said, this is huge. I didn't know there was such a large organization to help others get into a whole different field of medicine. I had no idea. I had no training in that area. So I got up in the morning early, went to my first class in Module 1, bioidentical hormones. And the first speaker talked about the boldness of stepping out of the caterpillar line. That was how he used it. And leaving that fold. And then the caterpillars all looking at you like going, what are you doing? So I knew it was going to have to take, boldness and energy to move in this direction. But it was my passion. It's what I wanted to do. And I got through that first module, and I went out and I got to know some of the secretaries behind the table there that were in the A4M, and I just looked at them and I said, you can't believe this. You're not going to believe what I just learned. You understand? And they're looking at me like, everybody says that. Everybody says that. It's like you come out and you're like, this new light goes off.
Right.
Like, what? We're actually going to learn about these pathways and biochemistry and how things work and the differences between what nutrition and actually bioidentical hormones do, and amino acids and fatty acids, and we're going to learn this, what it does to the cell. Okay, and I applied that to my body because I was not doing very well medically. I was on several drugs, hypertensive, I was overweight, pre-diabetic, and all because of my injury. Cortisol stress went through the roof. I was catabolic. I didn't know that stuff. I was just given medicine. Irritable, anxious, take a sedative. Can't sleep, take a hypnotic. It wasn't working for me. So the slight selfish reason for doing all of this was for self-repair. But now that I've gone through all this and I understand, there's so much more to it. And as I put myself through these protocols, I have now beginning to sense total balance, which took years and years and years of work. Nutrition, hormonal optimization, lifestyle modification, stress reduction. It's amazing that your whole body can calm down, get focused. And then my career started to build. At that first module, I was walking around looking, well, how am I going to start this business? How am I going to do this? And that's where I met Max, who was with the BodyLogicMD franchise corporation, who is now married to Patrick, but she was not at the time. Max is a very interesting woman because she's very discerning. So you first meet Max, it's intimidating because she looks at you and she just stares at your eyes, and you know that her energy, she's feeling what's going on inside. And she wants to have, she's guarding her baby of what they're building, making sure they have the right fit. And so, after like what seemed like 20 minutes, and it was probably 2 minutes, then we shook hands and we started to talk, and she and I really connected, and I got so excited I ran upstairs in Las Vegas. I went up to the hotel and got Ava. I said, come on down, you got to meet this woman. And we talked for a while, and there was an opportunity where we lived in South Carolina. There was an opportunity to start a BodyLogicMD franchise. So we pulled that together, and we bought a franchise, and I continued my education. and continued to go through the I4M and the MMI, and I got board certified. I went through the credentialing. BodyLogicMD has strict credentialing criteria, okay, because they have certain standards that you have to meet. So it forced me to be on time and get my credentialing in, which at the end really helped me. And so as I went through functional integrative training and application to my patients, my passion started to flow, because now I have patients, and so the reverse is now true, where now I'm sitting in my office. We have a beautiful office in Greenville, South Carolina. We just built it about, 7 months ago. Beautiful. I'm sitting in my beautiful office, and a patient walks in. They sit down. 1 out of 2, and within 2 minutes, starts to sob. And I'm like, I was there.
You didn't even tell your story.
I did it. I was there.
Right.
And so we hand them a Kleenex. We talked, calmed them down, and said, it's okay. There's hope. My main job on my first visit is to give them hope. So we give them hope, and then we go into, okay, this is what we have to do, and we have to find out where the breaks are, metabolic. We call them metabolic derangements. Where are you broken? What are you exposed to? What fuel are you putting in your body? What are you allowing to come in contact with your body? And we work through all those issues, and we just peel that onion one layer at a time. Let's take the most obvious and peel that away, and then we'll get to the second and peel that away, and take care of those onion peels metabolically, one at a time. Balance the cell, bring in the hormones. Hormones are very important. They're cell signals. So the hormones connect to the DNA, and they give instructional signals of what to do. That's a very important thing. And so I explain this all to the patients, and inevitably they're going, I get this. I'm on board. And so we take their hand and we just walk with them. It may be 6 months, it may be a year, it may be 5 years, but we walk with them through their recovery process, optimize their health, help them feel better, gain energy, bring marriages back together. We've saved many marriages. Sexually, they were a disaster. So we deal with sexual wellness. I openly talk about that with my patients. Bring intimacy back into their marriage. Restore their love, intimacy. It's a great thing. So that's what I do now. I'm very happy doing it. It was a journey to get here. It was a big circle. The pain was worth it. But the pain was a necessity for me. I had to go through that to get to where I am today. I wouldn't be where I am today without what I had to go through.
I'm so sorry for that journey, for what.
I'm not sorry for it. I'm thankful for it.
Right.
No, I'm thankful for that journey. And I tell that to my patients as well. We have to talk about that for a second, because I don't think anyone should be sorry for their past.
Well, I'm sorry for the pain that you had to endure.
Thank you. But you need to embrace your past, and you need to embrace your pain, and you need to be thankful for it, because what it did was it created for what you are and who you are today. The greatest people that I've met are the people that have had, the most challenges and the greatest pain, because they have such depth.
As far as a physician, that a typical physician, and I've heard this story so many times, why is it always seem to be that it takes some sort of personal crisis, some sort of personal health crisis, either for themselves or family member, for a physician to realize that conventional medicine is not, there's something wrong with it, that it's broken? Why is it that it can't be the norm to look for the root cause of something and to take a wellness and an integrative approach? What's your opinion about that? Why? Because
the norm is in fourth gear on a highway going 60 miles an hour, and they're in cruise control. There's no reason that they need to get off the exit. No reason. They're comfortable. Air conditioning's on. They feel good. They love their home. They like their family. There's no crisis. Crisis stirs the soul. And so when you have a crisis and you re-examine your life, then you re-examine your future. And you start asking the question, why? Why am I doing what I'm doing? And what hit it hard for me was I realized how finite life is almost being taken out, I'm like, I'm given a second chance. This is crazy. If I'm given a second chance in life, what am I going to do with that? Right? What am I going to do with that second chance? I'm going to make a difference. First, to help myself. Second, to help others. And so I think the crisis is important because you have to have soul searching. And then that leads to self-examination. And you wouldn't do that if you're in cruise control. So
what do you say to physicians who are practicing regular traditional medicine? Do you ever get into it with them? Do they ever question the practices that you are doing within? I
think there's a place for traditional medicine. And I like the integrative approach. I like the fact that when you're trained in holistic, more functional integrative healthcare, that we can integrate with traditional healthcare. I mean, truly, if I'm really sick, the United States is a place I want to be, because we have really good protocols for really bad illnesses and possibly surgical issues. And so I think there's a place for traditional healthcare, functional healthcare, and integration. And I say to my colleagues, I've done what you've done. You haven't done what I've done. So I understand what you're doing, but you don't understand what I'm doing. Please just research it. Even if you don't examine it to get into it, just understand it. Because there's a place for this and you. And once you examine it, then I challenge them. Which way is better? Although both may very well be needed. Okay? So that's kind of how I approach them.
Have you had to confront any criticism from any of your colleagues?
Oh, absolutely, of course. Yeah. We call our office in Greenville the island of the misfit toys.
So you and Dr. Heyman have the same slogan, right?
When patients can't get better and they don't know what to do, I'll just send them to Dr. Orbeck.
Right.
See what happens over there.
So they do refer patients to you?
Oh, yeah.
That's great.
Yeah.
Have you been able to inspire any of them to actually seek out the education?
Actually, I have. This is a great story. I got to tell you this story. We have a board-certified obstetrician that's very, very well known in the community, and I mean we have many of them, so I'm not mentioning names. But he does high-risk OB, and he recently saw me with some issues, and it was affecting his potential marriage. He was going to get married, and I sat him down for a consult, and he goes, but I've got these issues and I'm getting married on Saturday. And so I said, okay, well, let's just go into the other room. And I stopped the consult and I began some treatment and outlined some protocols. And I helped him with a lot of issues that were troubling him before he was going to go off and get married. I helped him with a lot of issues. And he looked at me and says, this is incredible. So I've never seen anybody just like flex and then do this, and you know these protocols you're giving me I never even heard of. They all you know, a couple weeks later he goes, they all worked. He goes, I want to do this. So this gentleman is actually now seeking out the A4M and he's going to enroll in his first module. So
that's exciting.
That's exciting.
So you spoke yesterday, as I mentioned earlier, for 8 hours.
Yeah.
And
that was a grueling day.
Yeah, I'm
but
sure
it was fun.
It was. So what was your goal at the end of the day?
To inspire physicians and help them understand the application of hormonal optimization, the different delivery systems, and to get rid of some of the myths and examine the truths of hormonal optimization. That was my goal. It was also my goal to help them understand that there's a business side of functional medicine. And you can love nutrition all day long, but at the end of the day, if you're not bringing home any money, your clinic is going to close. So if you can find a win-win situation where you have a good business model that parallels excellent patient outcome and care, that's a win-win. And so several times through the lecture, I want them to understand, you know what, you guys, you don't have to be afraid about talking business. The amount of sacrifice you made, amount of education you have, you better make money, and good money, to give to the patients what you're doing. It's not about that, but we had to talk about that. It's about patient care, optimizing their health, and my goal was to help them understand hormonal application, the different avenues, and then marry that with how can you help your overall health on a business side as well. So, you know, I had to learn all that. It took me years and years. I mean, the first 2 years I was in functional medicine, it's really kind of funny because my tax returns, and they had this little round number on it, and I didn't like it.
Understandably. So is your tax return now shaped like a pellet? Is that it? So speaking of which, can you explain why you prefer to use that method of delivery?
I use all method of deliveries with hormonal optimization, gels and creams and oral, depending on which hormone it is, and the safety profiles and the research behind that hormone. What I have found, however, is that when I use testosterone optimization, I get the best results from subcutaneous pellet placement. Interesting enough, when I started out, and BodyLogic knows this about me, I would do my seminars talking people out of pellets. And I would say, well, I just thought they were invasive and aggressive.
That seems to be a common theme out there for
Exactly.
people that don't know.
So I would have seminars at night, and I'd have 20 people in the room. And we'd offer little hors d'oeuvres. And I would put up my screen, and I would talk to them about bioidentical hormones as one of our marketing tactics, so they get to know who Ken Orbeck is. And they come in the office, and I would inevitably say, they would ask, well, what about subcutaneous hormones? I said, oh, no. Too aggressive. So for 2 years, I used transdermal gels and creams and transvaginal and, you know, different oral, of course, not estrogen, but oral hormones as well. I mean, I used it all, but I was anti-pellet. And I'm working in a community, and I have competition. And some of my patients are leaving me because they're seeking subcutaneous hormone delivery, and they're doing better. So I had to examine that whole situation and do some research. And what I did was I decided to get trained. And so I went out west with one of our physicians, and I got trained in pellet placement. And I did about 7 or 8 cases, and I thought, wow, this is really interesting. It's not that invasive. It's not that traumatic. And I scheduled 3 cases on the Monday morning I got back because I wanted to force myself in, you've got to do this. And so I got back on Monday morning. I did 3 pellets on Monday, and I have started to do pellets that week, and I've been doing subcutaneous hormone delivery ever since. Now, it's not the only way I do hormones, but it's the preferred way that I utilize testosterone. After doing the research, looking at all the articles out there, and now I'm actually doing a workshop, 2-day workshop, teaching all of the history behind pellets, understanding how the hormone delivery is different, understanding the neurohormonal endocrine connection is very important. Because when you put a hormone in the body, you just don't want to flood the body with the hormone. So if I come over and inject you with a hormone, push it in, it's going to flood your system. I would rather have a delivery that if I put this hormone in, it's going to have a variable delivery based on your neuroendocrine, which is eventually your heart rate and your blood flow through the body. You put a pellet in, it's surrounded by a capillary bed, it heals. Now, when you go run or exercise and your heart rate goes up, you pull off more hormone. When you rest and the heart rate goes down, you pull off less. And we documented that and we looked at circadian rhythms through the day, which are very important. We looked at hormone levels throughout the day, which actually change based on the heart rate and neuroendocrine connection. So when I examined all that and I started to do hormone pellets, I also realized that my patients were doing better on pellets.
So why do all these myths and people that are out there, and why do other physicians believe that it's, too invasive, or there's all these complications?
What I have found, because, so I believe the same thing, but what I have found is it's not invasive, really. It's minimally invasive. I mean, yes, you do put the pellet in through the skin, so it's minimally invasive. The delivery system is more physiologic. There's a circadian rhythm, plus you have adjustments of the hormone based on the neuroendocrine connection. The patients seem to do better. And then on the other side of the coin, you're holding your patient's hand because they have to come in to have their pellets. And so now I'm walking them through their hormone delivery. I'm not losing touch. And what I have found is the more I do that, the better they do, the happier they are. And that's been studied and proven, that if you connect with your patient, you know, and you do it on a regular, frequent basis, that they're going to end up doing better.
So is there anything along your journey that you wish you had done differently?
If I look back on my whole life, I'm happy where I am. I always think to myself, I wonder if I would have been good in the Navy and going into the armed forces. And I'll never know the answer to that question because I'm too old now. I do like structure. And so I think, you know, I would have had a really good opportunity to travel around the world. I love to travel. But I'm very happy where I've landed, and I'm very happy with my career. I'm very happy with my affiliation with BodyLogicMD. Very happy with my colleagues. We have a tremendous group of physicians that I get to connect with every day through internet. We talk on offsites. And I've realized that I probably couldn't do this solo on my own in a little building, isolated from others. You have to connect. So we're all a team. And everybody through the A4M and the MMI is a team. And we discussed that during this recent workshop, that we're all a team here. And that some of you in the audience probably know more than I do about certain subjects I'm teaching, because that's your field. But it doesn't matter. So if we're all a team and we examine the data and outline protocols, let's all go out and let's do that. Let's push the envelope. Let's research. Let's pool it together and let's be a team. And I think as that whole encompassing team of anti-aging and functional medicine physicians get together, I think we're going to be a really powerful force. I think the force is, you know, the patients are demanding it. They're demanding this to happen. So we have to take a role, and we have an obligation and responsibility to push us using science and research. So about research and development, I'm all about it, and pushing this envelope forward so that we get respect from our colleagues. That way we can truly integrate. Integrative medicine is the way to go.
What do you think healthcare will look like within the next 10 years?
I think what we're going to do is we're going to get heavily into genetics. I think there's going to be specific protocols and strategies based on the genome. And I think we're going to get heavily involved in different applications of stem cell therapy.
And what does your path ahead of you look like?
My path is to continue to practice functional integrative medicine. It's to advance my career educationally. I want to advance into further aspects of understanding genetics. I particularly want to understand more aspects of stem cell technology. We have a beautiful facility, and I want to bring in another physician to help journey with me. So that'll free me up a little bit, and I can possibly do more education. So I want to get involved in the educational role. I want to continue in the functional aspect of actual care to the patient. And I want to experiment my education in those two areas of, you know, of genetic testing as well as stem cells.
So what do you hope your legacy will be?
I hope my legacy at the end of my journey is respect and care. I hope that, you know, we all have things in our life we've done that, all of us, that we wish we wouldn't have done, or have experienced things that we wish we wouldn't have experienced. But life is not a simple walking a line. It's all over the place. And at the end of the day, I hope someone will just say, he really cared. He went the extra mile.
I'm sure they will. Maybe many years from now, but Thank you so much for your time, Dr. Orbeck.
You're welcome.
Your patients are very blessed.
Thank you.